suture someone up, make sure the skin is clean. Do you guys know why we do that?
Would that be the saline? The clean bottle? Alright.
The clear bottle is saline. Use the cloth to rub and wipe off any dirt or anything that could be on the skin. Like I asked, do you guys know why we do this?
Why don't you take a shot at this one, Cadet?
Don't dip the skin. Stop it. Stop it. No. That number one, you don't drink saline. Number two, you don't dip the skin in the saline. You dab the saline on the skin.
Saline is essentially extremely salty water. It's not good for you to drink.
Bloody hell. All right, so take your finger out of the bottle. You wanna dab the cotton you got right there with the saline and clean the area that you're gonna suture. And listen to Dr. North. Why would you apply saline to a wound?
Flush out any nasties.
Yes, that's actually really good. We use it to make sure that the wounds do not get infected and the person doesn't die from an infection. Because you want to know what happens if a person dies due to you not cleaning a wound?
They lose an arm or a leg. Oh no!
Well,
no, they're dead.
If they die, then you get hung for corruption and failure to provide proper service.
This is why I did not want to come here today, because
So, in other words, write down saline is the first stage of disinfection.
Yes, first stage of disinfection.
I don't want to die for corruption if I kill somebody by accident.
This is why we're here, Cadet.
Alright. So, what you're going to want to do is pick up your needle and clean it with the saline also.
Sorry, can you say that again, please?
You're going to want to grab the needle and rinse it with saline. Then you are going to want to thread it with cat's gut. It is not made of actual cat's gut, that's just the name of it.
Fucking Hastings, you told us it was cat gut, you liar.
You believed me?
It's not actual gut, it's just thread. You want to put that through the needle, tie it off the end there. You want to tie that beginning of the thread to the needle. Don't make the knot too big, because it's got to go through the skin for the first suture.
You'll hear from the lady why it's called cat gut.
God damn it! Why? Why did you just do it?
Probably
sorry, Devin, I just wanted to test that.
Balls in the title, and you gaggy, and there was just big skin. Cut it up.
I can't get it through it. Oh,
But,
it's a bit small.
Cat's gut is a type of cord that's normally made of sheep, goat, or just cattle gut.
So why?
So I'm touching a sheep's gut.
So why don't they just call it sheep's gut instead of cat's gut?
I believe cat is short for cattle.
I need some help here.
Technically, it's the proper term is kit's gut or kit string, which kit typically means fiddle or violin. So essentially, the cat's gut was originally meant to refer to the musical instruments.
Get the fuck out, alright?
Yeah.
Learn something every day. Take notes, Cadet.
Oh, there we go.
There you go, buddy. There you go.
Full time to charm, as they say.
One of the great thing about it, it's a little thick. You might have to try a little hard to get it through. It'll be all right. And
wait, what are you using back there?
All right.
My beard.
What?
Long story.
To explain, if you do not have thread and you're in the wilderness, a patient needs to be stitched. Something you can use is the patient's hair, as the body does not fight its own cells.
And it was much easier to get a beard hair than to lift up his head and then get a
I've got a question, madam.
Yes.
Please, don't laugh at me when I ask this, okay?
I know this is gonna be dumb.
We had
can't-
far
So,
stupider questions last time. Don't worry.
If the person is bold, right?
God damn
Not to go there.
If the
I
Can
person,
you
told
do
you.
what I just did?
I don't want to be, touching any.
I'm not gonna
anything,
say it
okay?
again, man. I
Alright,
promise.
just a disclaimer. I went over this with him beforehand, and he still does it. He still
No,
does it.
I just like, what is it corruption if I don't want to touch any certain hairs in case he's bold
I
enough?
told you about the coffee
I
ground.
forgot. I forgot. So
Yes,
I
it's
can still
corruption.
be hung then. Fuck. I
No,
don't
it's
carry
not
coffee
corruption.
on me.
It's not.
Lieutenant,
it's
I don't know
not
about this
corruption.
one.
I told you I'm not good at this stuff.
Just
Just
don't do it with your
please
own hair.
Do not pull out
I would.
the hairs
I would
down
never
below the
put
belt
my.
for the love of fuck.
I would
No,
never
no.
put my
Through this
lucky
question.
Just
box.
lift up the
Yes,
arm,
indeed.
use that.
I will say, do not. Again, we established, do not use pubic hair or ass hair if you are tying a suture.
Alright, duly noted.
It is
Indeed.
not
Arm hair.
sanitary.
Doesn't
Indeed.
seem sanitary.
dive
Even if the
in.
person's bald.
Even if the person's bald,
Like I said, don't use that.
if they're bald, then pack the wound and transport them to a doctor.
Isn't it kind of
I
funny
am
how a man can be bald up top, but he's never bald down below?
Stop. I will
There's
push
another
you
time
out
for
the
questions
window in
like
front
that.
of the
Come
lawman.
on.
I am so
And-
happy that I got very long and strong hair.
Anywho. So, your needles have been cleaned and threaded. So, what you're going to want to do is insert the needle into the tissue of the wound, starting from the inside, going outward. Start from the middle, pull it out, and then pull the needle back through the middle point of the other side.
Evan,
Oh fuck.
Yes, ma'am.
Oh fuck. Oh.
Yeah,
if we ever
the
go to
needles are
another
sharp.
one of these lessons, you need a bigger beard or a longer beard.
A longer. All right, fair enough. I can get Dr. Bavic's beard eventually if I let it grow out. It'd be a hell of a thing.
Thank you.
Yes, ma'am.
What do I do again? Sorry.
Well, first, since you accidentally stabbed yourself, you're going to want to take a piece of gauze that's on the table and essentially press it against the wound, letting the blood get soaked up.
You stabbed yourself. God damn, son.
I'm glad you're over there to watch them. I'm sick of it.
Listen, I signed up to be a police officer, not a doctor.
I know, but this is for you to save my life someday, and it's not looking good.
I was all. Actually, no. She'll say that. No, actually, no. Sorry, ignore me.
Pay attention.
Yeah, sorry.
Okay, so once you've pulled it through, then you're going to want to start from the opposite side from where you started, and go from the outside inward, and then continue making those stitches along the hole, leaving a small loop to be able to continue the next stitch.
Oh, there we go.
Alright, raise up your hands when you've finished getting to the end, because there's one important step you have to do before you tie it off.
Damn, son. Looks like you actually got maybe a knack for that. That's not bad after you stab yourself.
They don't call me the butcher for no reason, sir. I'm a man of many talents.
Fuck's sake.
Yes, indeed.
and never mind. Sorry. Can I ask a question?
Yep, go ahead.
What's this box in front of me with the bottles?
We'll be getting to the other bottle in a moment. Or are you referring to this over here?
Yeah, them ones.
That's where we put amputated limbs in.
Keep it up.
Um,
You'll be in there too.
Can I look in it afterwards? I'm
I
quite
do not
curious.
recommend it, but if you're brave enough, go ahead.
I am the
So I may
sorry.
have already done the next step and now I'm ready to tie it up, but Devin's beard is so short that I do not actually have any
Blah
thing to tie.
blah blah. You tie the end.
Alright, so
Whatever.
like I
By
said,
the
once
end
you
with
reach
the air.
end of the wound, raise your hands, and once all three of you have your hands raised, then we will go on to the step before tying it off.
Could you repeat what you just said? Somebody cut you off a bit.
Raise your hand once you finish getting to the end of the
What
wound.
was that important thing that we did at the end?
Well, I'm about to go into it.
Oh, okay. You hadn't said that yet. Okay.
No, I haven't.
My
Alright,
God.
so all
let the
three of you
doctors
have
do
raised
their
your
job.
hand. So, the thing you always check before you tie off the wound is the retention. Is it too tight? Is it too loose? One of you three take. Actually, I want all three of you to take your best guesses of why we check how tight the thread is.
I forgot to clock in after I
I
signed
went over
out
this.
or had to
So,
relog
yeah.
a while ago.
Yeah,
God damn
it's
it,
not
that's
fair
like
if I answer.
$75. Just gone.
I've got
It doesn't
this.
matter.
Go, cadet. Let's hear it.
So, if it's too tight, it will tear the skin, and the wound will just come out. No, hang on. No, the thread will come off. And if it's too loose, it won't seal, and then you'd have bleed to death. I think.
Not
No?
technically, yes.
Oh,
So, if it's too tight, the threads will pop, causing the patient to resume bleeding. If the threads are too loose, well, it's not clogging anything. The threads aren't holding the skin together. That is why we always check how tight threads are. So, go ahead and check. Did you do it properly? Is it too loose? Too tight?
I mean,
If it's too-
how do you actually know how tight is tight? Like, do you just flick it with your finger or run your finger over it? I don't really know a measurement of how tight it should
Now,
be.
think of the threads like sponge cake. That's the density.
Oh, good
You
old
want
cake!
it-
Oh yes.
You don't want it to be a pound cake. You don't want it to be stiff and hard and not able to move. That's too tight.
That's what she said.
But you also don't want it to be loose because your finger will slip in and that means it's not holding jack shit. So
Can I have
it
a
has to
special request?
What's the special request?
Could you include the exception to the rule regarding the scalp?
Ah, yes. The exception comes with the scalp. As there is not a lot of skin, you have... Actually, Devin, would you want to explain this one?
Yes, I can. Yes, ma'am. So,
Be sure
On
you're
the-
yelling.
on the scalp, there's not as much tissue. Everything's stretched pretty thin across the scalp as it stands. So you would always want to suture tighter along the scalp line for any head injuries. Just for that fact. I mean, there's not a lot of space. Like if you grab your forehead, try and grab your forehead right now. You can barely even grab the damn thing. There's not a lot of skin there. Everything's already pretty tight. So when you're applying sutures to the scalp, headline in general, you just want to go a little bit tighter than you normally would for other areas. The looser the skin, the less tight that suture has to be to make sure that the dermal line is holding together. But that is the exception to the rule.
Thank you.
Alright, so once you check to make sure that it's nice and properly fitted, then you're going to tie it off and snip it.
I believe this gentleman has a question, ma'am.
Yep.
So, say if we find ourselves in a situation where we have someone who's been injured but who's conscious and awake, and they've got a pretty bad laceration, how would we do this and them not feel pain?
So, you could apply some cocaine to the wound to numb it, or
Do we have
If-
that in the bags?
typically not, but you
Oh,
can
damn it.
typically find. This is where the other part comes in. Clove oil. Clove oil numbs the skin.
Clove.
Yep, clove oil.
Is that in the bag?
No, but you can find herbs all throughout
Do we
the
have
state of
anything
Monroe.
in the bag that can help us?
So, 3 vials here that typically, I mean, if you have a medical bag, which if you're first aid certified, you would, gentlemen, even as officers of the law, there's cocaine powder which you'd place around the injury, around the site of the laceration, to numb the pain that they might experience. There's amylin powder, which is a coagulant that's going to help you stop bleeding. And
Coagulant?
then coagulant. So it helps the blood clot, help stop bleeding. And the third one, that's
Alright.
clove oil right there. That sweet-smelling liquid, which Dr. North just mentioned.
So, yeah.
So we would just give them that, and then just carry on. And
You'd
when
put
we
it
feel
around
pain.
the wound,
Mhm.
and then proceed to stitch. Or, if you want to risk things, you can always, depending on how big the wound is, ask your doctor to put them under ether. But this is in cases where there are no doctors around. This is why people should learn first aid, because there is a tad bit of a shortage on doctors right now. There's not a lot of people around. It's the holidays, and you won't always have someone within a block or two away to come save a patient. So then it leaves it up to you guys.
Right. Could you repeat what that coagulant stuff was? Powder?
That is amylin powder. It's AMYLUM. Amylin powder. It's a combination of a couple of different ingredients that helps stop bleeding. You sprinkle it on the wound. It's also called sulfa powder. But that's what you're using to help stop the bleeding and prepare the injury for sutures, whatever comes next. The main thing y'all would want to do is stop bleeding first. If you can get to a medical office when someone is available, you want to. Well, Dr. North will talk about packing a wound here soon enough, but
Alright. But it's not
Also-
something that we would use because it's not a part of the medical kit.
it is. And so
is,
amylin
isn't
powder
it?
is
Oh.
in the medical bag. Yep.
Alright, so the cocaine powder and the amalgam coagulant powder is also in a medical kit.
It is.
Yep.
It is.
Perfect.
Also,
Alright.
hello to the 2 people that joined mid-lesson. We're currently going over first aid training.
Okay, cool. Sorry.
It's okay.
So,
Sorry.
Fucking always someone late for class. You had to be.
You are not
fellow
excused
who's
for being
smoking in the
tardy.
back, could I get your name?
Right, it's Virgil Lancaster. I'm
Oh,
here
hi,
for
Mr.
classes to
Lancaster.
observe.
Alright. Alright. So now that the wound's been tied off and snipped, what you're going to want to do is use the forceps and with the cotton ball on it and dab the diluted iodine onto the sutures. Do you know why we do that?
I have a question.
Yes?
What's diluted iodine?
You are at the end of the suture lesson, but the beginning of first aid still.
Oh, yeah, no,
Is
but
that
what is
the-
it?
Is it the second stage of disinfection?
Yes, it is the second stage of disinfection.
Iodine is an antiseptic, man. It's something that's used around the suture area or the laceration wound area in general. You don't want to apply it directly into the wound. That's what saline is for, but iodine helps prevent infection.
Gotcha.
Yep.
Thank you so much.
Mm-hmm.
I first have a question.
You said you had a question, man?
Yeah. So I know you, when you treat someone, you have to do it. You have to put it in your book, and eventually you have to probably send that somewhere that there's like a main board with everyone and their whatever happened to them, everyone and their I don't know, pains, injuries. That's it. But I don't really have that. If I treat someone and help them, and it's like something small, what do I do?
You would want to take a note of it in a notebook for any medical personnel that you run into. If you're just first aid certified, including the officers, you want to take a note of your patient, get their name, what you did, so you can relay that to a medical professional if the situation arises. And it probably will, because you're providing first aid. They probably need more treatment. Other than that, you would not be providing an official medical report, as we do.
Yep. But the reason we're also teaching Lumen how to suture is because, well, one, Miss Bella had given the permission for this to be taught, but also, yes?
So is first aid sufficient to treat gunshot wounds?
It is. You can use it to help aid someone in not dying from a gunshot wound, but it will not save someone from a gunshot wound.
All right, so we're not going to be going over, for example, taking out a bullet or something.
I would hope that you don't take out a bullet.
Nor would you
I'm
ever
not
want to
planning on
suture.
it. It's just I am subject to your teachings, after all.
You would never want to suture a wound without first reviewing the lodged bullet. Sometimes a bullet has to remain inside of the wound if it's pressed up against an arterial area or vascular area where removing it would cause more damage. However, in many of the situations you're going to be facing, and that's going to be covered here fairly shortly, you would want to pack a wound and get them prepared for a medical office. If the bullet is lodged, you're going to need a doctor's help, but you can stabilize your patient and get them there.
Yes.
All right.
So the injuries people who are first aid certified are allowed to help handle are horse kicks, falls, and then there are stemming bleeds, which you'd be given things like tourniquets and cornstarch. You'd also be helping handle drowning, hypothermia, heat exhaustion, broken bones sometimes, broken noses, dislocations, and puncture wounds, arrows, general stabs. There's also snake bites, strangulations, burns, general shock. There's a world of things that people who are first aid certified are allowed to help handle. Yes?
If they've been bitten by a snake, and they just gonna die from the stuff in the snake's what's it called? Hang on.
Not every snake is venomous.
Venom?
That's it, venom.
Yep. So the way you would handle a snake bite is you would have, if it's where you can, so like on a leg or arm, you'd want to tightly tie a knot. So with whether it's your gun belt, a bandage, anything you have, about 2 to 4 inches above the bite, and keep the affected limb still. If it's the torso, then you have to keep the patient completely still as it is. It's important that you do not suck up the venom. I've seen a lot of stupid idiots try sucking up the venom. That just leads to 2 dead patients. Yes?
In that case, maybe cutting where the bite is might help, to drain the venom.
That is something for the doctors to do, not for first aid certified people to do. What you would do is, if there is no medical attention available, keep the area clean and wrapped with a cloth to prevent any further infection, but keep an eye on the person and essentially pray, because if they do not get that venom out of there, then there is a good chance they may die. Essentially, this whole thing is a major case of, if you aren't careful, someone will probably die.
There are not any natural remedies that might help to drain the venom in such cases.
There is a way to drain it. It's only listed for doctors to do.
Oh, alright.
Alright.
One more question. So, worst case, okay, just in case it just ever happened, I tend to have weird things happen around me. say someone's bitten in the neck or on the head with a snake, well, by a snake. Obviously, you can't really tie the head, can you?
Yeah.
Do we just accept the fate that they're dead, or what?
You'd get them comfortable and let them pass. They'll be suffering, but it probably won't be for long.
I shall sing them a nice song.
Don't make their passing more painful.
Oh, whoa! Back in England, I've got a very nice voice. I love you know.
We're in America now.
I will say too, even being first aid certified, there are going to be situations where you're dealing with a patient that is far too injured for you to even be able to get them to a medical professional in time. In that time, it happens. Don't blame yourself. You did the best you could.
Alright. Back to, so we can finish up the sutures. You've all cleaned it with the iodine, so the last step before you'd bandage it is of the herbal salve that's in the tins that are on your desk. You'd apply it around the sutures. Would one of you guys like to tell me why we do not apply it on the sutures?
Maybe it puts too much pressure on the sutures.
That's a guess. Anyone else?
Can you repeat the question?
Why do we not put herbal salve on the sutures?
As it might aggravate it?
That's also another idea. Anyone else?
Because of the moisture in the solvent, we want this wound to dry and heal and let the body do its thing. So we don't want anything to contaminate what it does.
Yes and no.
Half points.
Yep, we apply it around the wound to make sure that the skin is not dry. We need the skin to stay wet and moist.
That's what you said.
So
I
why
heard
don't
that.
we
Sorry.
put that on the sutures?
Because it could pose a risk for infection, but also it can dissolve the sutures. That is why we do not put it on the sutures.
All right.
Alright, so that covers the suture training. Now, let's all go downstairs for the fun bit.
This shall be interesting.
A fun bit.
I'm gonna eat granny sausage. Oh, there we go. That's not
You gotta
very
calm
nice.
it down. You're the worst.
This
in
is so
public.
nice, though. I'm starving after you, my lady.
Get out, Ollie. My God.
You guys are concerning.
Indeed. He enjoys eating his sausage.
Good to see my cat.
I was gonna bind you up and take you down.
But you can anytime, man.
I know. That would have been.
Yeah.
I would maybe have looked a bit weird for them though. Me just coming down with your initials.
I do not mean to be about this, but this is
Yeah.
very important, guys. Do you mind to keep attention to doctor? Thanks.
Alright, I'm going to grab my 3 patients, explain something to them, and then I'll bring you all into the other room for the activity.
That is so wonderful.
They're beginning to be amazing.
Hey, is this a test or not?
Alrighty, so this is going to be a test very, very shortly. Yep. She said explain something. Well, what I'm going to explain is just be prepared for the unexpected, work together. No.
All
Don't worry
right.
about it, it's consensual. Don't worry about it, it's consensual. We need him.
Uh,
I don't think that was consensual.
Has anybody failed this test?
Oh,
Okay.
Put him down.
do you have something to drink by any chance?
I have a little bit left. Put down Devin.
You are far too
It
strong
can be.
carrying me, goddamn.
No, put him down.
Thank
I'm
you.
serious.
Alright.
Yeah.
God damn it.
Ay,
I
Dios
didn't mean-
mío.
I didn't mean to pick you up. I'm sorry.
Ah!
Do you want me to set him free?
I-
Set me
I-
free.
I'll pick you- Okay,
Oh,
Okay.
bloody hell. Okay.
so
He never listens.
okay, Devin, you are going to be the broken bones patient.
Okay. Sounds good. Which bone? Any bone I want?
Any bone you want. You're unconscious, so plop on the floor.
Here?
All right, Seraphine. You are drowning patient. Plop on the floor.
Again, and the patient me?
You are a puncture wound. You got an arrow stuck somewhere ever you want. Plop on the floor.
Oh,
All right.
Damn.
Oh no! There's been a mass casualty in Saint Denis. Go ahead, go to Saint Denis over there.
Oh, let's go.
There's no doctors.
Telegram out to the doctors right now.
There's no doctors in state
Oh,
right now.
oh no.
Go
Oh
ahead.
shit.
Oh shit!
Assess
Oh,
the
fuck.
situation.
Oh no. There's no doctors around. Okay.
There's no doctors in state.
Oh, fuck.
Well, this woman seems to be very wet.
That's,
hell?
are you checking the right place?
Fuck. Shit.
Come
I'm
on.
panicking.
Come
Get
on.
over there.
This is sabotage. All right.
Get over there. Help that man.
Come on, you two. There's a patient unattended. Figure out what's wrong with him.
Hello? Can you hear me? Hello? Hello?
All right. Looks like she
Fuck.
she's
I don't
choking
wanna
on
get-
water.
I don't want to get.
All right. Let me just
Alright. With each of them, explain to me what you guys are going to do to your patients.
I'm turning her on her back and see if I apply pressure to the abdomen, she might puke out the water.
I'm gonna get him naked and see if he's been stabbed or shot or bitten. I told you I'm not good at this, Starsky. I'm panicking, okay? I'm panicking.
Darcy, why don't you give him a hand? Come on,
I
join in
think
the
this
fun.
is just a
I can't
fucking.
see any wounds. Can I?
Why does he have to be naked? God damn it! All right, check him over. See if he see what you see. Let's fucking figure this out. All right.
So, with the drowning,
Okay,
you're
so
doing a
let's
good
check it out.
job. The first important thing to do with a drowning patient is make sure you can resuscitate them.
Okay.
If they're unconscious,
All right. So let's
try to
just
get the
roll
water
his
out of
sleeve
them
up.
as soon as possible.
We don't need to get the man fucking
I am
naked.
trying.
You're in a fucking ocean. Take her out of it.
What? She's on land. She washed up on the shore or something. I don't know.
Why can't I just be a normal officer who's dumb as shit and can't help and just
Come on.
fuck?
Because let's save this man's life.
I knew she'd have.
Alright,
But you knew
go
how
ahead,
was that.
Cadet. Tell me what you're going to be doing.
Okay.
I'm still back in the reindeer. Give me a second. I'm a bit slow.
Hold on. I'm here to help you. You're gonna be all right. You're gonna be fine.
Right. What I'm gonna do
Seem to have
is
been having
look
some
inside
water
of the
trouble.
wound.
All right.
Water
Is that
trouble.
right?
Yeah.
Yep. Remember, you're only doing first aid, so you're not going to be operating on this man. You're just going to make sure he is stable enough to get to a doctor.
All right.
As she pulls out a knife.
Yeah, you noticed that too?
Very salty.
Okay, so this wound
bloody.
seems to be,
All right.
seems to be like
Well, I
broken
mean, this
or something.
carpet is not a very
So-
nice
Give me some
shoreline,
cloth!
but
Stop panicking.
can you tell us where we are?
Just stop the bleeding. Just fucking
on the
stop the
I don't have
bleeding.
the bag on me.
All right.
He's gonna
Alright.
fucking die.
He's
How
not
much-
actually bleeding. This is all just practice.
How many
So
fingers
you
am I
would
holding up?
stabilize the wound. You make sure it's no longer bleeding, and
I'm panicking. Sorry.
All right.
you, if
Alright,
you have
I
the wound,
think-
Just a finger?
use sticks as a way to
Yes,
make
I
it
have
Starsky, give me
fingers.
some sticks.
I think you may have
Quick.
need of
Alright,
a
go ahead and
doctor.
explain to me what you're doing.
You seem to have been
Okay, apparently
unconscious
she has
for a
an
while,
arrow in her shoulder.
and
Starsky's fucking
understandably
broken.
so, you might be very confused due
Oh,
to a
fuck.
lack of oxygen due to the brain.
Are
you able to sit up?
Stick on him now and stick on his own plate.
You people are loud as fuck.
Starsky,
All right.
stick.
Are,
So
you're
she
still
has an arrow
salty.
in
Do
her
you want
shoulder.
something to drink?
It's not bleeding too much, so I'm just
Oh my
making
dear
sure
sweet
there's no dirt
Jesus
in
God.
it and wrapping
I'll
it with
try
some
that.
gauze I have in my pocket, just
There
leaving
you go.
the arrow in.
Well, unfortunately,
that
I
you
only
guys
have a
can
bottle of
remove
milk,
it.
so you're just gonna have
There
to
you
check
go.
that.
Yeah.
Virgil,
okay.
you want to join in on the fun?
All right. And now I pick her the fuck up,
I need some help with this
That
one.
arm isn't going nowhere. Don't you worry.
and we're going to a doctor. Bye.
Okay. Thank you.
Don't take.
All right.
All right, now just sit here, drink that, and actually just have a breather. I mean, you've been through a lot.
Don't worry.
All right.
No
I
answer.
will run
Yeah,
over
we're
at least.
sitting here for a while.
All right. Now, do you personally feel that you need some serious medical attention on account of you not being able to count my fingers?
Ah, God, why would you do that?
His wound is secured by sticks.
Decide that.
There's some gold in it to
I agree, but I just want to know how you
fuck,
feel.
hang on.
Oh, are we doing another one?
I'm gonna have. Alright.
I'm a bit dizzy.
Go ahead.
Hello?
All right, are you okay to be transported, or do you want to
Wrap-
wait here?
Wrap
while
the
I-
split. You got
Yeah,
you
no
got the
problem.
sticks right.
Yeah.
What do you do with the
Transported.
splits?
Whee!
All right,
Good practice. Even if
I
you're
will.
not free for
I am
first
hereby
impression.
transporting you, and
Yeah.
if you could follow me for a bit.
I
Yes.
yeah,
All
fun,
right,
darling.
you are a
Stop
doctor, right?
stealing the patient.
Doctor,
Hey,
don't go
she
away.
said she wanted to be stolen.
What you would do, partner, by the way,
Alright.
is
This is the
you,
part
the splint
where I
part
hand
is
her
right.
over.
You got the sticks
Yeah,
right,
I
but just
just-
wrap those in place so it's
You
secure.
bend over
to
the
have-
patient, and then you would explain what you did and what was wrong.
That was
I'm
Yes,
trying my fucking
as I
best,
was
Alfie.
saying, I resuscitated her. She seemed to have drowned.
There's no bleeding
Spat out
injuries.
all
I'm
of
not
the
bleeding. I have no
salt water,
lacerations,
and
anything
now
like
she
that.
seems
Just
to
a
be
broken bone.
His wound
confused
is
and
now
unable
now
to tell how
secure
many.
sticks. I've cleaned it out, I think, anyway. Now I'm gonna stick some bandages on there and get him to the fuck it off.
It's not. Take a
Thank
breath.
God.
It's
I'm
not
taking this
bleeding.
very seriously here. Yes, I know it's not bleeding. I've cleaned out his fucking broken arm.
Okay, so you did a good job.
I'm a deputy.
You did a good job.
Okay,
Only
so
thing
at
I
that
would say
point, you would
is
once the
the
splint
only
is
reason to
secured,
not
you'd get me to a
transport
doctor's
patients is
office
if
so
they're
they could get
I
them
got that
properly
word you're
treated.
saying
Other than that, there you go. There you go. That's it.
so sorry.
That's it. Make sure it's
Fuck
tight.
for the fucking doctor already.
Make sure it's secure. That's all right.
I think I'm done.
It's alright.
The
Sorry,
most
I'm a bit
important
confused.
With
thing
that,
to do is to stay
We would get to a
calm.
medical office, so we're good.
Is it a broken leg or a
I'll-
broken
We're
I'll
all right.
pretend like-
Ah, congratulations.
At this stuff.
It's all right. That worked. That
I
wasn't
was
bad. It
teaching
wasn't
people
terrible.
for fun, so
So I
It was an
put some
attempt.
sticks on your arm, so
it's more
obviously
memorable
it
instead of a
wouldn't break
standard
anymore.
lecture.
And then I cleaned it because I don't want you to get any
Also,
ants in there.
who ran off while you were treating?
I
And then
will
I'll put
say,
some-
if the,
how sorry, go on.
I was
I
just
think
gonna
it was
say,
the
if there's
lady with
a
the
broken
hair
bone
slit
with
to
no
the
signs of
side.
a laceration, because sometimes people fall off a horse, they break their arm,
Yes.
they're not bleeding, but they still have
Okay.
a fully broken bone. You don't necessarily have to clean that wound. You would want to stabilize the bone, like you did with the sticks. Put it in a splint, secure it with a bandage, and get them to a doctor
so
who can
sorry, but I
fully
don't remember your
determine
name.
whether or
Is it
not
F-
they need
F-
surgery, what they need to fully
That's
treat the
the
wound.
one.
But that would be first aid.
Awesome.
If question, if you fall off a horse and you break a rib and then you get black or blue
All
bruising
right,
around
let's all
it, then
take a
you
moment
get
to
a ton of bleeding, isn't it?
appreciate the amazing
No, so
performance. then.
black or blue bruising means you're bleeding it perhaps internally, but
Yeah,
you're
yeah,
not
that's
you're
what it
not
says,
bleeding
internally.
externally. So you need to get them to a doctor as soon as possible. You don't need to sterilize an area that's not bleeding externally.
I was panicking, okay? I was taking it very serious. My acting skills were on point then, just saying. So, if, say, example, right, we are, I don't know, fuck me, up in Ansberg, yeah, somebody has got deep blue bruising, yeah, and there's no doctors available, and then what?
If somebody has deep blue bruising, one of the things you'd want to do is make sure they can take a full breath. If they can't without severe pain, you need to get them to a doctor one way or another as quick as you can, because that's a punctured lung, which is going to be something a little bit beyond what you'd be able to treat.
I'm the butcher, I can do it.
For a
Don't you just stab a needle into them?
something
I would never do
that's
such
that's
thing.
part of the process, but it depends on where. And so again, if they're not bleeding, if they're not actively bleeding, you're not applying gauze, you're not sterilizing an area, anything like that. What you want to do is you want to stabilize the bone, get a splint on, secure it with bandages. That's the 2 sticks on either side, and get them to a doctor whenever they're available. But that's
from
it.
what I've taken from this is I'm gonna get hung from killing somebody.
You're not gonna
I'm
get.
fucked.
I think what we've learned is that all of you, we're all gonna do shit when it actually happens.
Well, thanks.
Well, yeah, that's why you are here.
I'm kidding, love you all.
Oh,
Also, by the way, Devin, you owe me a rope.
Oh, you were
What
rope.
do I owe you?
Maybe
Right,
later.
Starsky,
No, Devin
Hayden,
here,
please.
he owes me a rope.
A rope?
Maybe
Alright.
maybe in a couple hours. We'll see.
Oh my.
So, out of 10, right? How competent am I?
You guys did all a really wonderful job.
No, me.
You were about a 7 out of 10. And the only reason I say 7 out of 10 is because you didn't pick up on I wasn't bleeding and what to do as a result of that, but
I
you
was in the
did
moment,
fairly well.
okay?
But that's all
I was
right
in the
because
moment.
you still ended up applying the splint and getting me stable. So
How did I do?
it was pretty damn. You, my friend, you were a calming presence to this gentleman as he was freaking the hell out trying to deal with the situation. So I would
That
say
would be the lieutenant, not me.
well then I did not see.
I was
your-
treating your friend to your left.
I don't know how you
He was
did.
treating me.
She's
I
standing.
was already
So
confused, like, wait, wasn't he treating me?
how did he
I
how did he
could've
do,
taken
Miss
the
Sarah?
credit, but
I think it would be like an 8 out of 10.
All right.
Is it just
Alright,
me,
I'll
or
take
is
that.
there someone outside standing by the window?
yeah, that's the
Yeah,
lieutenant.
the
of
other.
mine.
Oh.
He's having a cigarette.
I don't blame him.
Most people see
Yeah.
cigarettes up here inside.
Sometimes
Well-
he needs a moment. We always give him that moment.
Doc. Or doctors, I'm not sure.
Yes?
Doctor. Could you just do me a favor and always be here, so I don't have to go through that pain of, potentially killing somebody and being hung?
Oh,
Yeah,
yes, I will.
sorry. I work and live in Blackwater, so.
Oh, for fuck!
All right, you
What
know
were you
what? The
saying?
Saint Denis Police Department will take to it that whenever there is a patient, we will keep you the fuck out away from it. Okay?
Thank you.
All right.
I'm a man of many talents, but...
SDPD, preventing medical treatment.
Damn.
From a particular individual, yes.
Is his name Thomas Edgewater?
All right. Is there anything else we need to go over here?
Yep, there's one last thing. The most hydrating task of them all.
What?
IVs.
No.
Yes.
IV?
No.
You guys get
What?
to insert IVs into each other.
No.
hell
What
no.
is IVs?
No.
Woohoo!
Nobody's sticking a needle into my arm.
I'm-
God damn it.
Nothing, and nobody is getting to stick
Aw.
me. No. Not happening.
Someone give me that arm! I'm back into it. Come on.
No, not this man.
Nope.
Do not let this man ever.
No,
I swear
you
to
guys
God.
need to work on each other.
No.
I will-
Oh, hang on.
We need to work
Sasuke?
on each other?
I'll
Don't worry
stick
about
you,
this. Yep.
Everest, but nope.
Oh. Hell of an
My,
offer.
my.
But what? Oh my god.
Alright, so saline
give us needles.
bags are.
Give me a second.
Yes.
Give me a second.
Okay.
Cadet,
Not
don't
doing it.
disturb the lieutenant when he has his moment, okay? We don't.
I don't feel too confident.
Not
enough.
happening.
That man
Okay.
is stressed. Okay?
I'm stressed.
Yeah, but you're a cadet. You're supposed to be stressed. Come back.
Wow. All
All right.
So there are saline bags with a needle over in that room. You're going to grab one and come with each other. No, wait, no.
Come with each other, you say.
Shut
You
up.
wanna stay
Very
come with
interesting.
each other?
I hate all of you.
All right, well, Miss
I
Cecil,
hate
I mean,
all of
nope.
you.
Don't have a rope anymore.
I hate you all so much.
You said I don't have a rope anymore.
Didn't realize
Maybe-
this was going to turn into an orgy towards the end
Can I
of the
just
lesson.
stick
That's
his
fair
mouth
enough.
shut? How about that?
Is that what you're gonna
Please
use the
no.
rope for?
Okay, so you're going to look for a vein in your partner's arm, clean the area, then jab the needle in it carefully.
Yeah,
Alright.
that's lovely.
Could I take off your
I
gloves?
will,
You don't insert it, or do you want to insert it?
No, I definitely won't be letting you insert anything into me, but I'll happily insert it into you.
Yes, she needs to be
Alright.
inserting things into people, not the other way around.
The main thing
Alright,
that you
alright, come
Which
here.
is
Because I
Thanks.
see her
Let's go.
very
Let's
nervous.
let's go
wanna
walk
see
to the middle
other
of the room. Let's go,
Yep.
so everyone can
The
Man.
see.
bonus thing for this
Okay.
task is
Alright.
you guys will become pretty hydrated because IVs is really good at hydrating people.
Yeah,
The
that's
main
okay,
thing
I'm
you wanna
hydrated,
do-
Alright, so
I'll
what
pull it.
exactly am I doing? I'm going to look for a vein.
Yes,
This
you
man's
want to
arm.
try to expose a vein, typically right at the crook of the elbow, whether it's the left or the right arm. Unless that arm is injured, then use the opposite arm. Try or the wrist as well. You want to try and expose
Oh, wait,
the
I'm gonna
most
watch this first.
viable vein that you can. You
Alright, I'm
tap
just
it
gonna
lightly.
puncture it with a needle, and that's it.
You are so you're moving that IV along the vein. So you're gonna find the starting point and move it along where you see the vein, because you're going along the vein, intravenous after all.
Alright, what's the purpose of this?
This is to provide fluids, whether it be just simple saline for hydration or antiseptics, antibiotics, or not antibiotics, painkillers.
Alright, so there is a tube attached to the needle, I suspect.
Yep, and there's a small
Alright.
bag with saline in it.
Alright, well, if you would just stand still, Baron, I will proceed to insert a needle with a tube into your arm.
I hope it makes you happy.
No, it doesn't make that game.
Let it be known you don't keep the needle in the arm. At least I don't think so.
Not forever.
Is she going
I
to
would-
the
I
to
would-
the vein?
I would
Not
hope
the
that.
arm.
I would, yeah. It's
I
about to
can
say.
hear a frog.
So, like this?
Yes, exactly like
Yep.
that. That's perfect, my friend. First time. Good
Alright.
job.
Thank you, thank you. Do I just pull it out now, or?
No. You want to leave that in. What you want to do is you want to hold that bag, that IV bag, with the saline, whatever else might be mixed into that for the situation, above that patient's injection site. That way gravity takes care of the rest and you're getting a flow of the fluids into the body. You don't have to just hold
Alright.
it there. If you have a stand or something that you can put that IV bag on, which we do have, that also works. You don't just have to stand there.
Alright, Starcy, if just so you can get the last bit of your training, you can probably use Mr. Lancaster as your partner.
Alright, you know what?
I'm only here to look.
Baron, grab this bag and, I don't know, hold it above your head.
Well, now Baron has to jab you with a needle now.
Oh.
Uh,
Yes.
I enlist the lieutenant for that.
Nope.
Oh, he wants to butcher that
Get
out.
in there, officer.
I swear to God, if you butcher me, I'll come back. I'll haunt you for the rest of your life.
Fuck it. He can stick a needle into me. We'll see. We'll see what happens. If you hit my femoral artery in my arm and kill me, I
I don't
swear
know what that even means.
Have him go
to
back.
holy God. Alright, so
I feel
left
like there's
arm.
just a number of ways to go
Left arm
around.
right at the elbow. What you want to do first,
Looks like I got off easy then.
you want to use saline to sterilize that area. Like clean that area right by my elbow there, or my wrist, whichever you prefer. You're going to see veins. My veins are pretty goddamn visible. You want to tap on that vein, try and get it raised up a little bit, and that's the vein you're going to follow to put the needle in. And we'll see if you can get this right or not. Or maybe I am going to regret this. We'll see.
Yeah, it was nice knowing you. Thanks for the hit.
You're welcome. You're welcome.
Alright.
You know that
Hang
you
on.
probably are going to regret this.
So, I've cleaned the area now.
Alright, sorry about
I've
this.
found the vein, correct?
You've cleaned the area. You want to find a vein. So you're gonna see the blue lines looking running along my wrist or along my elbow there, right where my elbow bends. You're gonna tap on one that you think looks pretty big enough to stick a needle into.
Let me have a look on the other side.
All right, just keep looking. And you tap on the vein that you think is going to be the most viable for an IV.
This is not going to end well.
But bingo, there it is.
There it is. You see. All right, go ahead and tap on that. Get it raised up. It's going to be about 10 taps.
Yes.
Just get it raised up. Give it a minute. And when you're ready, God damn it, try and insert that needle into the vein, man. I swear to God.
Legally speaking, am I having your consent to stab you?
Yes, you do.
Officer talk there. That was smart.
Yeah. I'll
There's
just prepare my medical bag.
witnesses here. He did consent
Doctor,
to
call
it,
me
so it's not
crazy.
murder,
I'm
okay?
hearing footsteps outside.
Don't worry
stand
about it
witness
too
to that.
much. I've had
I
medical
think it's
professionals
called
fail IVs so many
involuntary
times. It's
manslaughter.
okay.
I think that's
So
still
just go.
manslaughter.
You're not gonna kill me. The femoral artery isn't close to the vein you just picked up there, so it's fine.
Bingo! There it is!
That's
There it
it.
goes.
That's absolutely it. That's the one.
All
All right, so go ahead and secure that IV with a little bit of gauze. And then you want to hand the bag to me, I can hold it above that area, and we're good. Good job, my friend.
Alright, now it's Starsky's turn to stab someone.
Oh,
I'll go and try and retrieve him.
He's coming.
Oh, Lieutenant, your third.
Yep, it's Starsky's turn to stab someone with an IV bag.
Roy, just leave it.
All right.
Yeah, the IVs
Good job,
are
buddy.
over in that room. You just need to go grab one.
Okay, all right.
So, what's the reason for the saying again?
So it's going to be to hydrate a patient if you're experiencing blood loss, or to provide initial pain relief. For first aid, it's going to be initially to provide hydration and like a blood supplement if they've experienced a lot of blood loss and they have a low pulse, low blood pressure, things like that.
Well, I'm no doctor, right? But I mean, what if they insist of some whiskey instead?
All right.
I mean, it depends on the wound. Sometimes a little bit of whiskey can be a good
Alright,
pain
I've
relief,
done
but
this
if their
multiple
pulse
times,
is
so
too
you'd be
low,
alright.
you don't want to give them alcohol.
That is reassuring.
Hey, how many pulses it's supposed to low? Or
If
how
anybody
joy?
is under 65 beats per minute, if you're checking their pulse, thump, 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 that's a problem. Don't give them anything that could bring that lower. Otherwise, you might kill them.
It's a little aggressive there, Starsky.
Listen, he's all right. He's tough.
1, 2, 3, 4, 5, 6, 7, 8.
28. Fuck. 28. No.
Go.
1, 2,
Just a little pinch.
6,
Go on this.
What are you doing?
Fine. You're fine. You're
So
fine.
if your pulse is too high, does that mean you're having a cardiac arrest and you're dead?
If anything is above 100 beats per minute, that's a problem, and you would want to get them to a medical professional to stabilize, because you're not going to have the medication that we would provide to slow their pulse. There are times where
So-
their heart rate's going to be too high, their pulse is going to be too high.
Just out of
something like
curiosity,
this.
what medicine would it be?
Well, typically we would use morphine to help lower, or there are some other options, but morphine is a good painkiller that lowers blood pressure and heart rate to a point that it's more stable if the BPM is too high. It depends on the lacerations as well.
Interesting.
So something like this over here with this IV bag and all that jazz. Fine with this.
Squeeze the bag. Squeeze it.
I'm not squeezing it. I don't want to fill the poor fellow with salt water.
It's good news. It's good nutrients apparently.
I will
just
say-
a
Anyone
question
here
to
kills
about-
anyone and executioner.
Wait, what?
What?
A little hydrochloride isn't bad in the veins, I will say. You're just giving them a quick drink, honestly.
I think he's
Right.
going to be drowning in the IV.
But yeah, the bag and the
Is the
just because you
needle and the
before
IV
about,
included in the
Doctor,
medical
may
bag?
I be excused? I can
Some
find
are,
a place
some
I
aren't.
refill my
It
flask.
depends on who packs the bag.
Right.
I'll
do you
return.
do you have like
shortly.
a list on what's in the bag? Because if I go to save somebody and there's nothing in there, I'm going to die. and get hung because of that. So
Well, this is why you always go to a doctor's office if you've already used some of your bag to restock. The bag typically has 3 to 5 different needles for you to use, multiple different types of threads, but you'll primarily only be using 2. It also has, depending on who packs it, some have IV bags, others don't. Then there is gauze, bandages, amica powder. Shut the fuck up. Anyway, Devin, would you want to continue the list? Because I feel like there's something. Or
I see it.
There might be. There's something urgent I need to think about. Devin, please take over for a moment.
What were we talking about? Are we talking about stabilizing a laceration?
No, we're talking about what's in the medical bag.
Oh, so essentially you're going to have
Hey, where's that cat?
3 different gauges of needles, whether it's large bore, medium bore, or small bore, depending on what you're putting in. Typically, in a medical bag, what you'd be using the most in first aid is a small bore needle, the littlest one for the IV. Large bores are typically for larger injections of vaccines, things like that. Medium bore is for IVs that need quicker fluid replacement. So if you have somebody with an arterial bleed, need to replace fluids quicker, that's going to be the medium bore. You also have a few different tinctures available. So you're going to have herbal salve in that medical bag. You're going to have amylin powder. Amylin powder is a coagulant I was talking about before. That's the sulfa powder you're going to sprinkle on a wound to help stop the bleeding, get them prepped for surgery by a medical professional. So you'd apply the amylin powder, you'd pack the wound in a bandage, which is also provided in the bag, and then wrap it in a gauze, which is also provided. So you're going to have needles, you're going to have a few different tinctures available as needed, and you are going to have different bandaging equipment available. You will also have the tubes, needle, and IV bag for an IV if needed. But that's about it. That's going to be your triage bag.
That's awesome. Who do I get to stick an IV in?
I mean,
I volunteer.
That'll be me.
Oh, never mind.
Yeah, considering you haven't had an IV stuck in you yet, and you did so well with your IV, yeah, put it in him.
I mean, I did, but okay. Anyway,
Yeah.
if you kill me, there's witnesses.
Alright, I'll be back.
My last dying wishes.
She's not going to kill you.
Can you give Starsky Granny sausages?
To be fair.
Cool. So
Actually, I will take those.
So again, where am I sticking it in is an age-old question, I swear. So
No. Who am I sticking it?
that's also an age-old question. It's the same question. So you're gonna focus on. You're gonna hand the gentleman right to your left here in the police outfit. Roll up your sleeve, sir, if you can, or take your coat off. She's gonna need access to the vein. You're gonna focus on the wrist or the crook of the elbow, either on the left or the right arm, depending on where the injury is. You always want to go opposite if they have an arm injury on the other side. You want to try and find a vein in the wrist or the elbow, the side facing the front, like the crook of the elbow there. Whatever looks the most prominent, whatever you can see the best, and you're going to tap on that vein until it raises up above the skin, and that's going to be the one that you try and put an IV into.
Slap it.
I haven't even done anything.
If I die a cadet, I'm gonna be pissed off.
Oh, shut up.
The femoral artery is above where she's putting a needle in, my friend. You're not going to die.
Yeah.
It might just hurt like a bastard there for a second, but we'll see.
So
You never know. How would I be stabbed?
Try not to get stabbed too many times. I know some people that start to like it after 500 times.
yeah, I've arrested people like that.
I think that's just your kink.
Oh man.
I regret becoming a doctor.
No. Leave your arm loose. Do not flex your muscle. Nope.
I just fuck.
Can I slap him? Will that make him relax?
Wait, what?
So he's relaxing his arm, and you, yes, slap it while you make him relax. That's exactly it. Just slap the vein and the crook of the elbow or the wrist. and the veins are going to pop up above the skin when you hit them. When you just tap on them enough times, and that's going to be your most viable vein. Whichever one is most prominent.
Sorry, fuck.
Will you
I can't,
stop it?
I can't help it. Hang on.
Stop flexing your arm, sir.
Can I request another one?
Relax your
No,
arm.
because unfortunately, that's all I'm giving you.
Right, I'm relaxed, okay? I'm ready. Slap me on.
Okay, fantastic.
Stab me.
Alright, I'm going to prepare the last exercise before you guys are officially certified. I just gotta make sure that everything is all
Please
set.
don't certify this man.
I'll see you all in court. I'll be the one being prosecuted for corruption.
Maybe we can sue them for wrongfully certifying you. How about that?
Yeah.
Well, we'll turn it around.
We take
It'll be
we
fine.
take no liability for giving someone a certification when they
got-
perhaps haven't earned it, but he did very well with his IV insert. Now he's a patient. This is the problem. He's doing all right. He did just fine.
Yeah, all right. Maybe. Yeah, okay. I'll give him some credit.
The first time
Not
that he
much,
tried to
that's
put the IV into my vein here in the elbow, he succeeded. He did a
Sorry
good
about
job.
that. Give
That
me
is
just like one more time. Hang on. Just like.
Oh fuck! Sorry.
Stop.
Panicking, okay?
Just stop. Relax.
No,
Breathe.
sorry. Hang on.
Breathe, my friend. In through your nose, out through your mouth. Everything is fine. Just let her work. Everything's gonna be all right.
Forget something to drink.
Right. I'm Baron Butcher. I'm British. Do it.
Oh. Okay, fantastic. There we go.
All right. So the IV is in. You want to have him, or if you had a stand, you could do it too. But you want to make sure that IV bag stays above the injection area, so gravity can take effect. And drip, 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 drip.
How long does it take for the bags to fully, go in?
About 45 minutes.
Here,
What?
hold this. All right, hold that right there.
Fucking, all right, holy shit! Hang on.
Hold that right there.
What if you squeeze it and then does it cut the time in half or not?
No, it does not. Don't squeeze the bag.
This has been stressful, you know.
All right, that's
I've
fantastic.
done many things in life, and holy shit.
All right, buddy. So that is a successful IV. Good job, ma'am. We're gonna do this right here.
Oh, should I take it out?
You left it in me.
So, what would be a scenario in which we use this method?
All right, so we're just gonna wrap this up. This is easy. You just take the needle out. You put some gauze on. You put some tape on it to secure the bleeding. It's not gonna be too bad, especially if you did it right the first time. So we're fine. And that's it. So you can roll your sleeves down. You're good to go. Leave that tape on for a couple
All the
hours.
days that I've been an intern, I've seen it in surgeries.
I'm gonna toss this over here.
And they're bleeding out and they need fluid.
Thank God that's over. Fuck me.
No, that's in the scenarios that I've seen it. You know that it can't be used to
I can do it again.
But it's
how many
just
times can
to
you reuse
stabilize vitamins or fluids so the body might be missing for any deep wound or anything of the sort. Well, the scenarios that I've seen it on my days that I've been intern is surgery. It's bleeding out and you need to constantly get the body with fluids. Otherwise, it might not survive surgery.
All right, and
So
what
what you're saying
scenario
is-
would we use it?
They're like really badly
Let's
injured.
say you find someone and
If a patient's pulse is low, then you're going to want to put an IV in it.
All right.
Thank you.
I don't need to know the intricate details of the subject matter. I just need to know when to use this. So somebody has a low pulse, you put in an IV. And
Yep,
hope for
or
the
they've
best.
been bleeding a lot. Put an IV.
All right.
Now, you guys ready for the final part?
Sure.
Sure. Is this
Come on
where we
over.
get to knock each other off our horse with javelins? I mean, never mind.
Javelins?
Holy shit. Is
this the middle age?
Go.
That's
Oh
an
my God.
interesting proposition. I swear.
I get to adjust this part of the course because you guys are lawmen, not doctors. But I get to still pose a similar question.
Are you going to punch us?
No, not
So
yet.
this is going to be the
Maybe
hardest
you
question
can.
you've ever had in your life. You better be ready for it.
Easy.
So I intend on posing the hardest question possible on all of you. But as lawman, your guys' job is to also do detective skills. So around this room, there's hints to what the question will be. Work together to figure out what the question will be. It's this specific room right here that we're currently in.
What?
Wait, hold on.
I
Wait,
can't
what?
say a word. None of us that aren't. We can't say a word. Y'all work amongst
Go ahead,
yourselves and
take a look around, use your own skills.
What even is this a knife?
apply.
Well, I don't understand the scenario. What are we supposed to do?
No, this is
Find
something.
a clue.
This is something special. So, for y'all detectives, look around the room. See if you can see something that looks a little bit out of place for the question that she's going to ask. This isn't even necessarily medical in nature. We're asking you to look around the room, find something that seems out of place, and come up with a question that she might ask here in a minute.
I mean,
Lawman,
technically,
be detectives.
I'm only a cadet still, so I'm not a detective.
I think I know.
Well-
I
Well,
think
be
I
a
might know
lawman.
the question then.
Well, still, go ahead, look around, inspect the room, figure out what the question might be. I'll be over in the next room. I'll come back when it's time.
This feels like a trick question, and we're just wasting our time.
I feel like it
That's
is.
fine.
Be
I'm-
sure
We're
to work
supposed to not
together.
answer this correctly, but
Be
There's a
sure
bag,
to
yeah.
work together.
all right.
Yes, I was
What is this? Some
So what do you
team
see,
bonding
lady?
exercise?
I don't understand.
detective.
We're not really
I
given
am-
much
there's
context. There's
Yeah,
a.
hang on, what's this here?
or half a
I don't
scissors,
know. It looks
can't
like a
tell.
knife.
Come on.
No,
There's
no,
a
this
I
looks like
want-
a
We have a
bench.
medical bag.
No,
that's a
fire,
knife.
You won?
No, it looks like a knife.
and
No,
that's
it's,
pretty
no,
much
that's a
it.
hairpin.
Okay.
Is it?
Time to draw your
What do you mean you were
conclusion.
one?
Okay, so there's a
Hairpin,
hairpin, a mirror.
hairpin.
Maybe
hairpin?
something behind the mirror that we use the hairpin to
I
get
don't
to.
know what medical
What do you see in the mirror?
All right, quick discussion here. Okay,
You
let's
see the
discuss
mirror.
this.
That's supposed to be a portrait, right? What do you see in that mirror? Because it's reflective. What do you see?
The flowers.
Us?
A sexy British man.
Get out of
damn
here.
it.
Indeed.
Hey,
The
alright.
flowers, a hairpin, and
A hairpin.
a
That
medical
is
bag.
so you saw your own reflection in
I
the
mean, you're
mirror.
not supposed to help.
That's the only thing I'm gonna give because you saw a mirror over there. So that's all I can say.
Is the question, why do we want to do this?
I can't ask that question.
The only question I would ask when I encounter a situation where somebody is, injured, would be to investigate the area to know whether or not there is still a threat.
That's fair. That is very fair. That's exactly what I would expect you to do. Indeed. And there's Dr. North.
So, what do you guys think the question I'm going to pose to you all is?
Be
I'll be
honest,
honest.
I have no fucking
Oh,
clue.
me
And
either.
I do detective work daily. You got me stumped.
This
I don't
feels
know.
like a trap.
Why
You know?
do we want to do this?
Yes, that's exactly it.
Okay, cool.
What
fantastic.
made you guys want to be lawmen? What made you guys want to help people?
The
I
money.
already answered that.
Sorry, no. To
You wouldn't have
to
been
help,
hired if you said that,
And you
by the
already
way.
answered that.
to
Yeah.
help vulnerable people being taken advantage of by the dirty criminals.
But
We uphold
what-
law, order, and peace. It's a set of beliefs that we represent, and we like to put that into practice.
that may be the case.
But
But
he's saying
I'm
he likes to
asking,
shoot people. I mean, never mind.
what I mean is more personal. Each one of you guys is your own novel. You've gone through many chapters of your own lives. What has brought you to this page of your life?
When did
What
this,
made you,
when
other
did
than,
this turn into a therapy session?
don't worry,
Shit, it's getting
First
ridiculous.
I'm a
day therapy.
psychologist, but I get to
Yeah,
ask
Oh,
this
fuck.
question because I like
Wild.
seeing what people's ideas are.
I'm just gonna go ahead and say that our desires to help people in need is what brought us to this page.
What brought me to here is my lieutenant telling me to come.
That's accurate. And
Very
I was
very
told
accurate,
to be
very-
here.
I did
Very
tell him that I'm
honest.
bad at this, but he did insist that I come. It's very recommended.
I am here to make sure that the cadet and officer are trained well enough to save my life someday.
Well,
Yes.
do you
Why
believe they were
just your
sufficiently
life?
trained?
I think so. I think you guys do a damn good job here. And this is definitely informative, and definitely you have the patience of a saint.
Oh yeah.
What that directs me then for panicking during the acting?
Not you.
Oh.
You definitely no.
I was immersed in the acting than I was, you know.
He did okay with the IV. He did well with the IV. It's all
He
right.
did. Yeah, give him credit where it's due.
Can I just say the reason why I'm here, honestly, is that yesterday we had one of our officers injured, and I did not know what to do, and I didn't like that I didn't know what to do.
Down here in Saint Denis or up by Scarlet Meadows?
Nope, right here.
All right.
What happened to Scarlet Meadows?
Oh, a gentleman named Tom, who also worked for the law, I think in Rhodes, got injured fairly badly. He lost a fair bit of blood. Dr. Godson saved his life.
Oh, Jesus.
I mean, it's made me more confident in that I can actually try and save somebody and not pour whiskey on the wound. So at least I've learned that. So yeah, I'll try and save somebody if I can. No guarantees that it'll work because I'm a bit of an idiot when it comes to this stuff.
You're not an idiot.
I mean,
oh, you're fine, partner. You're fine.
You're just a dumbass.
Damn.
I don't see how that's any better. Holy shit.
All right, so this is the fun part where I have to go to each one of you, have you guys write down your name, and then I have to submit the paperwork saying that you guys are fully first aid certified.
Baron
All right.
Thank you very much.
Let's give each other a pat on the back, huh?
You
Evan?
deserve it.
I'm gonna go for a nap.
Madam, how
Yes,
how
ma'am.
much do you rent this house?
Find your. If you want to head to the
the same
hotel, go
place.
ahead
This
and
is just
mention
the
my
medical
name. I'll
college.
give you a room.
Okay.
Yeah.
never mind then.
I
Oh,
expect
but
you later.
One thing I want to say
Yes,
before
ma'am.
everybody leaves. I'm obligated to say this as the chief investigator. If you find a body somewhere, don't pick it up to bring it somewhere. Take photos, bring along, alright?
Yeah.
That's a very
Also,
good call.
Everest,
Unless that body's
for adolescents,
No problem.
I am
Alright.
gonna take a nap.
Be sure to do it outside so you don't get locked inside.
Yep, I'm gonna go.
All
to
right.
This also, like I said, this also applies to if you are treating somebody who happens to die while you are treating them, as in that they have no pulse and haven't had a pulse for a few minutes.
Then it becomes a crime scene.
Then it becomes a crime scene. Yes.
Don't touch bodies. Just patience.
Don't suck snake venom.
We learned that.
It just sounds nice. though.
Also, don't piss in a fireplace.
That's also very accurate. Do not do
What
that.
happens? What happens if you
Do
do?
no. See,
It's-
no.
it's
You have to
ammonia.
tell them.
You know
You
what?
have
You
to
know
tell
what?
them.
It's
Find
ammonia.
out. Go ahead and find out for yourself.
Yeah, go
I mean-
piss in the fireplace.
What happens though?
And everybody else get out.
What happened? I'm just.
Yeah, we most certainly will, actually. I mean,
You just
we'll,
you.
Yes.
we'll treat the
I
burns
have
when it happens.
multiple
Let 'em
times.
do it. Just let them find out. Let them learn.
Yep, let him learn.
What? How is me
Go-
urinating on fire gonna do anything?
Go ahead.
Do
Go.
it. Go
What?
ahead.
I'm doing a fucking
Get the
dice,
fireplace,
Starsky.
do it.
Just go.
Wait,
Do it.
is this
Find
is
it.
this
Go
You're
grab
an
a campfire.
investigator.
Come on.
You get
Okay.
to test. This
Here,
is the
let
only
me make
time in your
this-
life you
Go-
get to
This
test
thing
this in a
look
safe
order,
environment. Now do it.
Go get a
Okay,
It's not
campfire.
a
well
safe
then.
environment
Piss off
for that.
then.
Just saying.
Wait, it would burn off my penis.
If he's gonna do it
What
on
the-
me.
Yes. Because you see, your pee is ammonia. And that is flammable.
Unfortunately, madam, I don't know what ammonia is. So.
Your,
They
Your
just-
pee. Your pee is alcohol. Alcohol catch fire.
so
It burns.
so
your
you
piss
drink
could
your
catch
piss
on
in.
fire and
Thank you.
burn you right up. Burn that
So-
snake right to the bone,
If your
I
piss
swear.
is alcohol, can you drink it if it's filtered? No, it's
I want to.
I'm done.
I want to
I'm
quit.
done.
I want to quit.
I'm
Thank you for
done.
your help and the training.
But- I
He's
need you guys'
disqualified from
names.
certification, I
need
swear.
this Paperwork handled first. Okay.
Why do I even come here?
I have to sound the same.
I'm sorry. I'm sorry. I'm sorry.
Okay. One moment.
Can you blame me for asking when she said it's alcohol? Like, I'm a man of many curiosities.
You're something. That's for sure.
Okay, so Starsky, can you spell your name for me on a piece of paper?
Yeah.
Thank you.
Starsky, do you regret hiring me? time to move to New Hanover.
Can we please rename this the Horny College?
What?
The fuck?
Hey,
Wait.
Yeah, because you people.
you people.
What do you
Whoa.
mean by that, ma'am?
Madam, I'm gonna have to ask you to calm
SDPD.
down.
Ah.
It's okay. It's
All right,
worse than
suspect
roads,
is
don't worry.
resisting arrest. No, I'm kidding.
Is that so?
Grab the
Whoa.
cocaine
Alright,
out of the medical
uh,
bag.
Alright, no,
Sprinkle
that's
it on
wide
her body.
enough.
Let's get out of
Okay.
here.
I'm kidding.
All right.
I still need to write down my name.
All right.
Love you guys.
Next one.
That would be me, Officer James Hastings.
Please write it down on a piece of paper so I could actually write it properly.
Hand me a piece of paper.
All right. So the rest of this before the next
You have a
storm in
small
our
notebook if you
final
think about
class
it.
for the day
All right.
will be just paperwork and stuff. So if you watch this,
Hasn't
I
she given you
appreciate it.
enough?
It's been a fun time. Absolutely. See you on the next one.